Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob with some tremendous questions. First time I had a question quite like this. Dr. Bob, my father goes through dialysis at least 3 times a week, and that has to do with kidney function. For those who might not know what dialysis is all about, his extreme itchiness keeps him up at night. According to his doctors, due to high phosphorus. He was prescribed a medication, which he says it's not working. Very interesting. In my book on preventing surgery, I have a chapter on cataracts. And in that chapter, I talk about the ratio of calcium to phosphorus. So it's very possible, and I'm not an expert at dialysis because I know that they limit water, or they like people to limit water. I'd encourage you to get that chapter, which is easy. Just go to druglessdoctor.com and you can learn more about the calcium phosphorus ratio. We use a product in our practice that I personally take 3 of every day called Bio-CMP, which does have calcium, magnesium, and potassium in it. That could be a good start to maybe help balance him out. We also use a product called Super Phosphozyme tablets. I would love to see the calcium phosphorus ratio should be 10 parts calcium but 4 parts phosphorus. Hopefully that will help make a difference. Dr. Bob, what reverse osmosis filtration system do you use? Well, there have been 2 that I've used in my lifetime. One is called Kinetico, and the other one is from General Electric. Both of them are very fine. You could probably find a Kinetico distributor in your area. I bought my GE at a local plumbing store, and then you just can contact them to buy the different types of filtration apparatus. Dr. Bob, what is a natural remedy for subpar thyroid function? This could be a very detailed answer from me. I wrote a book on balancing female hormones. I would need to know exactly your lab numbers, because typically if a TSH, Tom, Sam, Harry, thyroid stimulating hormone is elevated, they recommend that it's a low thyroid. You might need iodine, you might need L-tyrosine, you might need an oil. So there's lots of possibilities. I'd encourage you, if you're a female, to get Dr. Bob's Drugless Guide to Balancing Female Hormones and read the chapter on thyroid. And if you're a male, get Dr. Bob's Men's Health, The Basics. You could contact me. You could have some blood work done for us to find out what's going on. You may even consider a urine iodine loading test to make sure you have enough iodine. Dr. Bob, what products do you recommend for post-gallbladder surgery? I'm overweight with knee pain. I'm going to direct you to Dr. Bob's Guide to Prevent Surgery. I have a chapter in there on the gallbladder. We recommend 3 products. One is called Beta Plus, which is bovine bile. So you take your gallbladder out, you don't have a reservoir of bile. We also recommend Beta TCP, which has taurine in it, which helps thin the bile. And another proprietary product called Livitrit Plus, which is a variety of herbs that help support liver function. I would go to druglessdoctor.com and just buy the chapter on the gallbladder and read it, and you could find out exactly what you need to take. Very good question. Dr. Bob, do you recommend NUCCA Chiropractic? I suffer from Meniere's and vertigo and was just wondering if you think NUCCA could help. NUCCA, which is, to the best of my understanding, an upper cervical type of form of chiropractic. I would encourage you to try chiropractic before any kind of medical treatment. I also would avoid peanut butter, dairy, wheat, and sugar. You may consider the food's sensitivity test, and I'm sure that your adrenal glands are probably exhausted. Very good questions. I know this will make a difference for all of you. I'm Dr. Bob DeMaria.